Hey guys, it's Kylie and Billy here at the lab. In this video, we're going to be going over how to perform subcutaneous injections. These are the ones that we use for our peptide therapy. For your peptide therapy, the supplies that you can expect to receive are a vial of peptide in its powder form, a vial of bacteriostatic water, a large syringe with a larger gauge needle, some alcohol wipes, as well as some insulin syringes and a sharps container. So your first step is going to be mixing your peptides. And for a reminder, you can always access these instructions on the box that your peptides do come in. So the first step is a lot of times these vials will come with little plastic covers. Go ahead and pop those off and you can remove them. Next, take an alcohol wipe and cleanse the top of each vial. Next, take that large syringe and larger gauge needle. You can simply take the base of the syringe and push it through the back side of the packaging. Then you'll remove the hub on the needle and take the bacteriostatic water vial, put the needle right into the middle and draw back the necessary amount of backwater. And you can always find that amount on your prescription. Once you've got all that water drawn up, you can now slowly inject it into the peptide vial. You'll see the powdered peptide dissolve really quickly. And always remember, once you've constituted or mixed your peptides, they need to be refrigerated and kept cold from this point on. Once the peptide is all dissolved inside of the vial, you're ready to do your injection. So again, you'll want to take an alcohol wipe and clean the top of the vial. You'll do that every time you draw up an injection. Next, you'll get the insulin syringe ready. So there's a bottom orange hub to the syringe. Go ahead and pop that off and you can toss it. We won't need it anymore. Then take the stopper bottom of the syringe and pull it back and forth a couple of times. This helps to prime the syringe and makes drawing up your peptide a little bit easier. Then the orange hub at the top, you'll pop that off and you'll see the needle. This one's super tiny. You'll flip your peptide vial upside down and put the needle straight into the middle. Be careful because these needles do like to bend sometimes. You'll then draw back the stopper of that insulin syringe to whatever your prescribed dose is. And once you're done, you can simply invert the vial, pull them apart, and you're ready to administer your injection. Once your peptide's all drawn up, you're ready to do your injection. These subcutaneous injections are usually done in the lower part of the abdomen, anywhere there's a little pinch of skin that's easy to grab onto. You'll always want to prepare the skin with an alcohol wipe. So we'll pinch up the skin, cleanse the area in a circular motion, and let it dry. Definitely let it dry for 5 to 10 seconds. It'll help it sting a little bit less. Then you can expose your needle, pinch up the skin, straight in, press it at whatever rate you feel comfortable, and remove it straight out. And that's it. With these types of injections, make sure you're doing a different spot on your abdomen every time. You don't want to inject the same area over and over again because it'll just make it a little bit irritated. So with peptide injections, we anticipate there to be some bruising or maybe even redness, itching, mild irritation at the injection site. This is totally normal, but if you ever have any questions or concerns, you can always reach out to us here at the lab.